Welcome to our in-service training presented by My ALF Training on essential competencies for assisted living staff, venous thromboembolism, VTE awareness and response. This course is specifically designed for all assisted living employees, especially our direct care staff, and will take about 30 minutes. Our main goal today is to equip you with critical knowledge and practical response protocols concerning blood clots, ensuring we meet new regulatory standards, and, most importantly, enhance the safety and well-being of our residents. Providing excellent care in assisted living facilities means we must constantly update our skills. This training is a direct response to Florida Senate Bill 890, also known as the Emily Adkins Family Protection Act. This legislation is all about improving how we screen for, treat, and prevent blood clots, which are a serious health concern for our residents. A key new requirement for assisted living facilities is that we must now provide a consumer information pamphlet to all residents upon their admission. This pamphlet will contain important details about blood clots. Furthermore, for all of us, especially direct care staff, the bill specifically mandates training on recognizing the signs and symptoms of venous thromboembolism and how to provide an emergency response. This shows a clear shift towards more specific, life-saving competencies for us. Let's start with the basics. What exactly is a blood clot? Simply put, it's a clump of blood that has changed from a liquid to a gel-like or semi-solid state. While clotting is normal to stop bleeding, sometimes clots form inside blood vessels when they shouldn't, leading to serious problems. When a blood clot forms in a deep vein, most commonly in the leg, we call that a deep vein thrombosis, or DVT. These can cause pain, swelling, and warmth. A pulmonary embolism, or PE, is a much more serious, life-threatening condition. This happens when a DVT breaks loose and travels to the lungs, blocking blood flow. Symptoms of a PE can include sudden shortness of breath and chest pain. The term venous thromboembolism, or VTE, is the overall medical term that includes both DVT and PE. Understanding these terms is the first step in recognizing and responding to these conditions. A significant new requirement from Florida Senate Bill 890, specifically for assisted living facilities, is that we must now provide a consumer information pamphlet to all residents when they are admitted. This isn't just a formality, it's a crucial step to empower our residents with knowledge. The pamphlet must contain specific information about venous thromboembolism, including its risk factors and, very importantly, how residents can recognize the signs and symptoms themselves. This new rule takes effect on July 1, 2025. As staff, we should be familiar with this pamphlet and its purpose, as it's a direct measure to enhance resident awareness and safety regarding VTE. Blood clots, including DVT, don't just happen randomly. They typically form due to one or more of three main mechanisms, often referred to as Virchow's triad. First, if the flow of blood slows down in deep veins, it can pool and clot. This is called venous stasis. Second, if there's damage to the lining of a blood vessel, it can trigger clot formation. This can be from trauma or even subtle cellular changes. And third, sometimes the composition of the blood itself changes, making it more prone to clotting, a condition known as hypercoagulability. Understanding these underlying causes helps us grasp why certain risk factors are so important. Several factors can significantly increase a resident's risk of developing VTE. Age is a major one. The risk generally increases for individuals over 55. Prolonged immobility, such as being confined to bed after surgery or during illness, is another significant risk factor. Certain medical conditions also play a role, including heart failure, active cancer and chemotherapy, chronic kidney disease, and autoimmune illnesses like lupus. Even sudden confusion or delirium can contribute to risk. Recent surgery or trauma can also increase the likelihood of VTE. Finally, lifestyle factors such as obesity, smoking, and dehydration are important contributors. In older adults, age-related changes in blood vessels also contribute to this increased susceptibility. Now, let's talk about what to look for. DVT symptoms usually appear in one leg, but they can also occur in an arm or the groin. Be vigilant for swelling in the affected limb, pain, or tenderness that might be throbbing or worsen with standing or walking, increased warmth in that area, and red or discolored skin. Sometimes you might even feel a rope-like cord under the skin. It's important to remember that some residents with DVT might not show any symptoms at all, which makes our overall vigilance even more critical. Pulmonary embolism, or PE, is a medical emergency. The symptoms are more systemic and demand immediate attention. These can sometimes be the very first indication that a resident has a blood clot. Look for sudden shortness of breath or difficulty breathing, which is often the first warning sign. Also, watch for sharp or stabbing chest pain, especially if it worsens with deep breathing. Other critical signs include a rapid or irregular heartbeat, a sudden cough that might sometimes produce blood, dizziness, lightheadedness, or even fainting. You might also notice clammy or excessively sweating skin, bluish skin, or the resident expressing feelings of anxiety or dread. Your ability to recognize these signs quickly is absolutely vital. It's important to understand that diagnosing deep vein thrombosis and pulmonary embolism is a complex medical process. This is done by trained healthcare professionals, such as doctors and radiologists, often in an emergency room setting when symptoms are severe. They use various methods, including a physical examination, blood tests like the D-dimer test, and imaging tests such as ultrasounds or CT scans. Our role as assisted living staff is crucial, but it is not to diagnose VTE. Instead, our critical responsibility is to recognize the signs and symptoms we just discussed and to promptly report any suspicions or observed changes in a resident's condition to the supervising nurse or healthcare provider. This timely reporting is what ensures residents receive the rapid medical evaluation they need. To reiterate, your role is absolutely critical. You are on the front lines, observing our residents daily. Your primary responsibility regarding VTE is to recognize the signs and symptoms we've covered. If you suspect a resident might have DVT or PE, or if you notice any concerning changes in their condition, you must promptly report these observations to the supervising nurse or healthcare provider. This timely reporting is the most important step you can take to ensure our residents receive rapid medical evaluation and intervention, which can be life-saving. Preventing VTE is a team effort, and assisted living staff play a vital role. One of the most effective strategies is to promote mobility. Encourage residents to move around as much as possible, especially after periods of sitting or bed rest, like after an illness or long travel. Even simple leg exercises, like raising and lowering heels and toes, or doing ankle circles while sitting or in bed, can make a difference. Encourage residents to stand up and move at least once every hour. Equally important is ensuring adequate hydration. Encourage residents to drink plenty of fluids, especially water, throughout the day, as dehydration significantly increases the risk of DVT. Continuing with prevention, we should also encourage healthy habits. This includes helping residents maintain a healthy weight and discouraging smoking, which is a known risk factor for blood clots. Encourage residents to wear loose-fitting, comfortable clothing. Also, advise them to avoid prolonged sitting with legs crossed or placing pillows directly under their knees, as these positions can restrict blood flow. If a resident has been prescribed compression stockings by a physician, it's our responsibility to assist with their correct application and ensure they are worn as directed. And remember, always promptly report any new or worsening symptoms to the supervising nurse or healthcare provider. It's important to know that venous thromboembolism, or VTE, has a strong genetic component. Studies show its heritability can be between 40% and 60%, meaning it often runs in families. This has been observed for over a century. There are several inherited conditions, known as classical thrombophilias, that significantly increase VTE risk. These include deficiencies in natural anticoagulants, like antithrombin, protein C, and protein S, as well as specific gene mutations such as factor Leiden. While medical professionals handle genetic screening, it's beneficial for us to be aware that a resident's family history of blood clots can indicate an increased personal risk, contributing to our overall understanding of their health profile. This is perhaps the most critical part of our training: the emergency response protocol. If you suspect a resident is experiencing symptoms of a pulmonary embolism, such as sudden shortness of breath, difficulty breathing, or sharp chest pain, you must act immediately. Your first and most crucial step is to call 911 or ensure the resident is directed to the nearest emergency room without delay. It is imperative that you do not attempt to drive the resident yourself. An ambulance should always be called. While waiting for medical help, keep the resident as calm and comfortable as possible. Always follow our facility's specific protocols for medical emergencies. If a resident shows symptoms of deep vein thrombosis, like swelling, pain, or warmth in one leg, but does not have any of the severe PE symptoms, you should contact the resident's healthcare provider or supervising nurse right away. Continue to monitor the resident closely for any changes in their condition and follow our facility's protocols for non-emergent medical concerns. Now, this next point is extremely important for all suspected VTE cases. You must never attempt to massage the affected limb if DVT is suspected. Massaging the limb could dislodge the clot, causing it to travel to the lungs and lead to a life-threatening pulmonary embolism. Your role is early recognition and rapid escalation to professional medical help, not direct medical treatment. To summarize our training today, remember these key takeaways. First, understand what blood clots, DVT, and PE are, and the serious risks they pose. Second, be aware of the new regulations, including the Consumer Information Pamphlet requirement for assisted living facilities and the specific training mandates for staff. Third, your ability to recognize the early signs and symptoms of DVT and PE is absolutely critical. Fourth, know the appropriate emergency response protocols, when to call 911 immediately for a suspected PE, and when to contact the supervising nurse for a suspected DVT, always remembering not to massage the affected limb. Fifth, consistently implement the prevention strategies we discussed, such as promoting mobility and ensuring adequate hydration. Finally, this training is part of our commitment to continuous competence. By applying this knowledge daily, you directly contribute to the safety, dignity, and overall quality of life for our residents. Thank you for your attention and dedication to providing exceptional care.